I always tell people that being in a place of authority and position of leadership is for nothing else but for service to humanity. And this gathering is a very significant one. It's very sacred. We're talking about lives. This gathering is about ensuring that we have people stay alive.
We are here. We represent the global malaria family. I can say that because right from the global level to the state level, we are all here in Osun State, and it's as regards the mass campaign for the distribution of insecticide nets that we are here. And based on your impact, your influence, and your interaction with the malaria family, we deemed it fit to come here to recognize and to appreciate your efforts over the past few years. Not to take so much of our time, we have a large contingent as you can see, and we wouldn't be able to take introductions one after. I want to believe everyone knows that we are speaking to the point right now, so I think that part is sorted. So I'll just introduce a few of our partners, and then just by organizations, and then we can express appreciation. So we have the CEO of the Global RBM Partnership with us, and that's Dr. Charles Adekunle. Please, you can
Good morning, Your Royal Majesty. Regal Majesty. Regal Majesty. We are here to really convey our appreciations to yourself, to the King as well, for all the support that you're giving not only to Osun State but to the national, to the federal level as well. I've been part of many meetings that you were also part of. The Rethinking Malaria, the RBM big push that we had last year in September, and your enthusiasm, your energy, your commitment really goes a long way. So that's why we're here to come and appreciate you and to say thank you. This week we'll be having some pet net distributions, and yesterday we did meet with the State Commissioner of Health, and today we'll be meeting with His Excellency the Governor as well, to again just appreciate everything that Osun State is doing. For the bed net distribution, it's important, and we really want you to lend your voice to the campaign, because we know that distribution alone will not save lives. We need to make sure that the bed nets are used. So through your support, through your office, through your personality, we really want to appreciate you, but also to plead with the people of Osun that they really need to use the nets. So we really want you to lend your voice to that cause as well. So thank you so much.
You're welcome.
Thank you very much, sir, for that good speech. I'd also like the Regal Majesty to know that we also have partners from officers of the Global Fund who are present with us. We have the NMDP represented here. We have also the Catholic Relief Services represented. The WHO is also here. IHBN is also here with us this morning. And we also have we also have SFH with us. Then the rest of us we are from the state. So the CEO of RBM Partnership has given us a very brief remark. So I just want to welcome the representative of the Global Fund to give their own remark. Thank you.
Good morning, Regal Majesty. My name is Dr. Jean-Thomas Mbugusi. I'm the country manager for Global Fund for Nigeria, the Global Fund. And I'm here with my colleagues, Kanini and Eve. We all came together. It's our first time in Osun, and of course in Ife. And it's also really a great pleasure. As I said, when I walk around, I I feel I'm at home. So I really feel myself at home. And when I see the kingdom, and also it also reminds me home when I go back home. See, and I want to add my voice to Dr. Charles to really congratulate you for really your commitment to the fight against malaria. We've been meeting in Abuja during all the big meetings regarding malaria, and we know your commitment on malaria. So really the appreciation of the Global Fund. We know without such commitment from traditional leaders, it will be very, very difficult to get to the objective of the Ile-Ife campaigns. Ile-Ife campaigns is not just giving net to people. It's really reaching one of the objectives of eradicating malaria, using one of the most efficient tools to eradicate malaria. So Ile-Ife, as I'm saying, is one of those tools, but among several tools. You know it very well. I was told you are a medical doctor, so, but also during this campaign, and one of the areas we will rely you, apart from ensuring that people use the net that are distributed, it's also to convey to those that will not be receiving the net, because in Oshun there will be around 23 wards that will not be receiving net, not because they have been deprioritized, but because of evidence that showing that with the reduced prevalence of malaria, we need to do targeted campaign, targeted distribution. We don't need to give net.
The affected areas.
We need
the most affected
areas, but those areas that will not be receiving net, they will be prioritized for other interventions like routine distribution, like treatment, school-based distribution, like treatment. So they should rest assured that they will still be covered by malaria.
Okay, your distribution is it just across Osun State or Southwest?
For this one, it's just
Osun.
State.
Okay, I need to.
And we are distributing close to 3 million net, targeting around 1 million households, and targeting like around 5 million people. So we will also be, during this campaign, integrating with TB case finding. And it's the first time we are doing the integrated campaign. So people should also be aware that those distributing, they will also be asking questions on TB case funding. And it's good that we are starting this initiative, innovating initiative in Osun, because it will be scaled over in other states. So let me stop and really thank you for your commitment.
Thank you.
Thank you very much for the performance. And right now I welcome the representative of the national coordinator to give us a keynote.
Good morning, Your Regal Majesty. On behalf of the national coordinator, we want to continue to express our appreciation to you for availing yourself to continue to promote the uptake of malaria intervention, for your goal that you have continued to support the program. You have all mentioned you have continually and relentlessly shown that enthusiasm towards the cause of reducing the scourge. Without the engagement that they already mentioned, you are always there to support the program. We cannot thank you enough for what you are doing to the country and the populace and the community at large. The national program is committed to having a malaria-free Nigeria through the deployment of high-impact interventions that are equitable and community-driven. And reason why persons like you, the Regal Majesty, are very key, because when interventions are not community-driven, the uptake always suffers. And reason why we're happy to continue to show and lead that process, both at local and even national level. Your presence always add light or colors to ensuring that malaria uptake is optimal. And we are currently just about to roll out our new malaria strategic plan that will be spanning 2026 to 2030, which has highlighted some of the things. Our interventions, we are deploying them in sub-national tailoring approach in a way that, of course, it's not all sides fit all. Like certain interventions, especially based on burden, and that is what has kind of been explained about the distribution of nets. But we are happy that all other preventive interventions are still very much in place in your domain. And for example, Osun State is the first state that would deploy perennial malaria chemo prevention in the whole country. Your state provided that platform where we piloted it, and we have seen the impact of the deployment of this perennial malaria chemo prevention. And we continue to appreciate the Osun State leadership, His Excellency, and the Ministry of Health leadership for availing us the platform to pilot it, which is strictly going to be in the southern states of the country. And the use of IPTP among pregnant women, intermittent preventive treatment. Good enough, you are a doctor, so some of these terminologies are not new to you. Also, prompt diagnosis and treatment of cases. We know it's not all fevers that are actually malaria, except they are tested before they are confirmed to be malaria. And all those interventions will continue and scale ups as resources are available. We'll continue to have more interventions deployed, especially to the high burden areas, so that we continue to. And we're also happy to inform you that the country has continued to witness reduced prevalence. All our efforts are not in vain. For example, in 2010, when we conducted the first malaria indicator survey, we were at 42% prevalence. But as I speak to you now, the country, from the last indicator survey conducted, we are at 15% prevalence. And Osun State is not left out, because the prevalence has also dropped. And that's why our strategic plan is looking to all low prevalence states. We want to bring them down to very low prevalence, such that we're talking about pre-elimination. And I'm sure, Osun, by the next time we'll be conducting the indicator survey, you might just be approaching the elimination. So we want to really thank you on behalf of the National Coordinator. We thank you once again, and by extension, the Coordinating Minister of Health, whom she represents. She's also on her way. And we really appreciate you. Thank you so much.
You're welcome.
Thank you very much to the National Coordinator. Your Regal Majesty, the CRS is also an important partner for us in the country. They are the principal recipients of the GM malaria grants in Nigeria, and the Chief of Party is also here with us. She will also give us a brief announcement.
Good morning, Your Regal Majesty. Thank you so much for your support to the malaria program. A lot has been said about that support, because we have seen what you have been doing for the program, and you stand out clearly as a leader, and I'm happy you're a woman, and you understand what malaria does to pregnant women and children, the most vulnerable groups. And we thank you for being visible as that leader that supports the program in the cause to eliminate malaria from the country. I don't want to repeat what my colleagues have said, but we are truly grateful for that support, and we are appealing to you to continue to provide that support so that malaria will be a thing of the past in our country. We know it's possible. Thank you very much.
Thank you, Dr. Francis, for that very brief remark. And Regal Majesty, you will recall that when Dr. John Thomas was talking the other time, he said malaria TB integration is being piloted for the first time in Osun State. So it's not just the malaria team or the malaria fund that is here alone. We also have the Institute of Human Virology, IHBM, because henceforth we're going to be working together to see how we can be more efficient in program implementation. So I'll welcome them for just a minute to just tell us very briefly. Appreciate just a minute, please.
Good morning. Regal Majesty. I would say I'm happy to be here. It's my first time of being in Keynote Palace. Even though I've actually stayed in Osun State for almost 2 years. And also, not just a beautiful palace, but also beautiful people. Incidentally, I would say that the ladies from Osun State are quite pretty. So, just like Dr. Olori had said, I work with the Institute of Human Virology, Nigeria, IHBM. We've been in the States since 2007, supporting different projects on TB and HIV. Currently, we are supporting TB HIV integration projects aside other projects in the state. And just to say that Osun State has been one of the best performing states in the country, and particularly in the southwest. For a couple of years, we actually.
You deserve a round of applause.
Yeah. So, and then towing the line of integration that as we talked about, being more blessed, definitely I believe Osun State will equally also outperform the other states. And now that we are now the pace center, it's no longer Oyo State, definitely we need to be another support. Thank you very much.
Thank you, IHBM. We also have WHO present. We all know WHO. They are everywhere giving us technical support, as they call it. The WHO person can just please appreciate the Regal Majesty in the minutes. We have So SFHs, Society for Family Health, they are the partners implementing with the state as regards the campaign. So they have, along with us, they have the history of what we have done and what we have left to achieve in the next few days. So to also appreciate you and tell you a little bit more about what has been done, what's happening, and what's going to happen in a few days, I would like to welcome the director.
Just say Hassan.
I'd like to welcome the prince.
Regal Majesty, it's honor and privilege, like I say all the time. I remember when it started 2023, and I went up to you and said, we want you to be that face, not just in Osun, but in the country. And you said, John, come to the palace and we'll do that. And we came here, and you did not only accept, but you hosted us so well. And since then, we've seen you across the country, standing as that face to bring the traditional institution into this leadership. We appreciate you, man. And we want to say that, we are looking forward to not just the talking, but also the doing. And that is why for this campaign, I have a prayer. And the prayer is that by the time we start the distribution, we'll be very honored that you will go out into the community on day 2 or day 3 and ask household, have you gotten your net? And tell them, make sure you use the net. The media follows you. And as you do that, the media will see it. We want you to be that leadership for other traditional people that they will see that so we can do and reduce the health of our people. Just to say that Osun State was at 19.3% for burden the last time, but today it's at 12.9%, which means we are making progress in Osun State. And those progress are also part of what we are doing with the ITM. So the net we are giving people is in support to other things like you talked about, different interventions we are doing in the state. And whenever we do this, we look at the leadership. There must be a conducive atmosphere, environment for this to flourish. And again, we want to look at the mobilization and ownership, participation of the people. And when the leaders lead, people will follow them. So for the one we are going to do now, we're distributing 2.8 million nets across the state. And based on the urban malaria control strategy, subnational tailoring, all the plenty English that we speak with it now. So 23 of those wards in the state will not be getting net through mass campaign, but they will get nets through the routine, which means that pregnant women and children under 5 can go to health facilities, doing antenatal or child welfare clinic and get the net. So everybody still gets the net across the state. It's just the medium of delivery. We're also going to do some things in some schools, about 29 schools in the state, so that students will also get, so households where those children are coming from will still get the net. So a lot of things are happening. And then, like we mentioned about the TB, we're thinking the states and the federal that if we can also improve health delivery and health care, we want to see a screening where children are coughing, sweating, those questions that we ask. If we now notice that those things are ticked yes when they go to the houses, they'll be referred to health facilities so that they can get further health treatment or support. So those are the things we intend to do. And the distribution will start from the 4th and run to the 8th of this month. That's on Thursday to, I think, Monday. Yeah, 4th to 8th. And then we have 2 days of mop-up just in case we're not able to cover the entire state. We are looking forward to a flag off tomorrow. And like we normally do, flag off, for us, they're not just ceremony. Flag off is to demonstrate ownership, participation, and mobilization of the state, especially for youth. So we're hoping that will happen. If we meet His Excellency today, we'll pray and beg him to come and speak inside the net so that we show you that the net is safe. Even if he's not able to, whoever will represent will work that to happen and show him. And then we also are going to be meeting or working in the community with town announcers who will be talking to people about the way the process is going. We also will go to the media and talk on the media. Sometimes if we finish right here, maybe we'll just get to one corner and see if we can record your voice. You can call on people and say, this is happening, please support, be part of it. So when we get media airtime, we can play it so that people will see that that is flowing even with your support, especially for the prioritization. Those places we are not giving nets, we don't want them to come and say it's because of party. So if a party person comes and say we're not giving net in some places, people look at it somehow. But if you speak as a leader of the people, people see it and believe in it more, and we're hoping that that will work for us. Ma, you've done so well that I think we should all rise and appreciate her for the wonderful work. So don't mind us, man. Now forgive me, man. When we're coming, you asked me that how many are we? You know, I told you that we pass like that. Like I told you, I told that everybody wants to come and see you, and that is why we're here. So thank you for the work you have done. We are counting on you for that push, like we said. I remember at that time also, man, we said that at the national level, probably you can even lead a coalition of the tribes of our traditional rulers to have a kind of meeting on malaria and talk to people. We don't know what can happen. Anything is possible. But with the results we have gotten in Nigeria, man, we believe that we can do it. And women and children are the ones we are putting in the forefront, that if the woman takes charge of anything at home, even in our house, man, when the women lead, everything works well. So we know that it works. So thank you again very much. We are honored to be here. Thank you.
Regal Majesty. Like we say in our place, man, so much of English, but for those who don't understand, I hope there will be an interpreter. So we would like to have a word or two also from you as we wind up this discussion. Welcome you.
Thank you. Once again, Happy New Month. It's a good feeling when you see the purpose of an assignment, you know, really coming into fruition. I always tell people that being in a place of authority and position of leadership is for nothing else but for service to humanity. And this gathering is a very significant one. It's very sacred. We're talking about lives. This gathering is about ensuring that we have people stay alive. Children, men, women, who will live a free life of this very deadly disease, malaria. On NSPPD today, I don't know, some of us who are NSPPDMs, someone gave a testimony, from malaria bites, just mosquito bites, and then from there, everything aggravated to cancer. And that really tells us how deadly this particular disease is. And you're not coming together different, parastatals, units. I acknowledge everybody today. And like my prince rightly said, it's not about just coming together, different units. Don't worry, I'll give you a beat. So anywhere you go, the symbol is there. You don't need to tell anybody, they just know that you're friends. It's okay to come together from different units, but we're all here for the same cause, to achieve one goal, which is to eliminate malaria. We need to take that cognizance of the fact that it's something that we must be intentional about. Yeah. We have different strategies. That's awesome. Now, but putting all the strategies together in achieving that one goal is what we should delve more on. And I think Mr. Godwin in Abuja, before, I think someone else is in charge of the malaria.
Yeah.
Give me an honor. I don't accept honors just for accepting sake. No. Don't just give me an honor and you just put me just right there in my office. I'm a very busy queen, yes, but busy for a purpose. And I always challenge you. You've given me this appointment as an ambassador, as an advocate for malaria elimination. We need to work. I need to just keep talking. I'm an action woman. But I am most excited this morning by the statistics of the results that we've been able to achieve. So please celebrate yourself today. This is a very strategic move. Why? Because we want to achieve success. That should be your end goal. What everybody should have in mind is, it's not just about the process. It's about what your mind tells you want to achieve. So how are we going to achieve this goal? If we all believe that we can achieve, then raise up your hand. Oh, good. Because that is most important. When you think it in your heart, achieving it is very seamless. So now that we have the same goal, we have the same mindset, we're sure of one fact, that we'll achieve success. We will discuss the strategy. He has said some, like, going out. Let me first say that I'm very committed to this. Yes. I'm ready to go to the ghetto. See, we need to be very strategic. Who are those who really need this net? Yeah. We don't want to waste our net. Everybody needs it, yes, don't get me wrong. But for those who are still a bit comfortable in their homes, the ACs are working, the environment still looks, a bit clean. The gardeners are there, the housekeepers are there. Let us go to those who really need it, who really sleep under only God knows, maybe under the bridge, in the ghetto, in the slum. Those who live very close to the market. Those communities that they just feel forgotten. Those are the set of people I'm most passionate about. If we must do this, then we have a drawing board. You already have some selected communities you want to go. I am ready to move with you. That I'm most committed. Let us see this as something that is very passionate and very intentional about it. Don't let us come together and work like, yeah, we need to get a result, or the minister must applaud us. You know, the state must recognize it. It's not about recognition. It's about results. If I'd known this like a couple of weeks before now, this palace would have been filled with a lot of people. Yeah. We'd have had 10,000s of people. Even just Children's Day, we had well over 5,000 just on the 27th of March. So now imagine going, because they always want to come. They always want to come here. We'd have had this place flooded with a lot of people. Those who really need it, you will see them, you will know. And then when they hear the Queen speak, just one voice, collectively, having them together, and then the voice goes out, it's very easy also achieve it. But it's okay. So I don't know the strategies we want to deploy. I'm most interested in that. I want to walk all the talks we've been discussing. Let us face it. Let us take the bull by the horn and let us achieve nothing else but success in eradicating malaria totally. It is achievable. Tell someone beside you that it is achievable. Some countries can testify to the fact that it is a success story in their country, so why not in Nigeria? And I'm happy about the fact that the pilot state is Osun State. Thanks for the money. So let us set the pace and let us take the bull by the horn. Thank you.
Again, thank you, my mommy. We're so happy for the energy and the commitment, which is one of the things we're saying that we can ride on. For strategy, one of the strategy already is this voice you are flying. And imagine if all the queens across the country would call women and tell them, sleep inside those nets they gave you. That's a very strong one. Now for the distribution of the nets in Osun State, the immediate strategy is to go door to door so that we don't miss any household in the communities where they're going to get it. So if the team gets to the house, they're asking how many people currently live in this house. Why they say that is because the person, they say how many people are here, the persons might be counting their children that are married and maybe in school, who might be covered in some other place, but how many people currently sleep or live in this house? Based on that, we're using technology. It will advise the distribution team on how many nets they are going to give to the household. And before they do that, they're also going to tell them how to use and care for the nets. And then when they do that, the next thing is to now ask for the children. Do you have children 0 to 14 years old here? And then begin to ask them those TB questions. Constant cough, maybe past few periods, and then sweat, night sweat, and something like 4 or 5 questions that they will ask. And as they tick, the device will also tell them to refer the child or not. And then they now give a referral slip and say go to the nearest dot center to do further investigation. So that's one. The other part of it is the SBC, that's the mobilization, the behavior change. And that is where you come in very strongly. That behavior
What do you want to do that?
Yeah, so for behavior change, the first level is the town announcers who are working at the community. One of the big problems we have had with town announcers for some time is that they don't have the tools to work. But we still try to tell them that even if you get gong, just make the noise, let people hear. But we wish they had the tool. But we do a training for them. We've done a training and orientation for them on what the malaria is, what days distribution will happen. So they go to the community a day before the distribution team will come, just to inform people that they are coming. They also will go there again after the distribution to tell people to use their nets. Then we're also asking people that since we started net distribution in Nigeria, we've done over 300 million nets in Nigeria since 2008. So we're also trying to manage the environment by asking people in their houses, if you have old nets, return them. So the team going will be collecting those nets. So the program we're calling the end of life nets, called EOLink. So when they go to the household and they talk to them, also they're supposed to ask if they have those nets to pull them back. So we're also going to reverse all those who are trying to clear and clean the environment as well. That's part of the strategy. And then the other one, we used to have, like in every of the local governments, like a net advocate. Sometimes we ask the local government chairman if they want to be or if they want their wife. Most times the men say they want to be, but they don't have time. So if we have the women as the net advocates, they can now become like your strings that you can pull from the local government and see what they also do at that level. And then I also talked about the national one. So that at the national level, there can also be some kind of movement that can happen where we can have, all this time we keep talking and it's like we talk about the kings, but can we have a queen movement to see how we can end malaria? And that is one place where you can play a role, man. I know we can sit down in Abuja and design things and all that, but there have to be that strategy that will work first and say, okay, this is what we want to do. We might not be able to do it in the country across yet. Then the country also, we have people like Dangote and the rest of them who are also supporting this program. Man, if you today, you tell Dangote, I want to see about malaria, Dangote will not see you. If you go to Dangote and say, Dangote, we are looking for money for malaria, it's a big strategy. If you call Otodela and say, we want money for malaria, it's a big strategy, man. So those are the strategies we want to put to see how we can get the local resource funding that we need to make sure that we can do this. And we could put that together. We can design, we have some designs that we can put together and make this work. But the biggest strategy, like I say, man, is you accepting this. And all that you say, I will say we're happy about it. Thank you very much.
That we're going to borrow from your passion and ensure that we keep the focus on results. Yes, we also be particularly happy in the program in the States. We look forward to those results. Anytime there's a malaria case or something, we are looking for how well are we doing, and it's gladdening. So it's gladdening to know that we're making progress. But as we get closer to zero, the harder the work gets, and that's why we need a lot of hands on deck to ensure that it works. I've been reminded just now that there's a flag up for this mass campaign votes tomorrow. That will be around 11 a.m. tomorrow. Yes, in the local government service commission, the secretariat. Yes, ma'am. So we would really be honored if your Regal Majesty would be available. So thank you very much for the time. I can't say thank you enough. I have one of my ambassadors who can say the thank you better. So most welcome.
Your Regal Majesty, it's a privilege. I didn't know I was going to come to people of times. But I think I want to adopt myself as your son. So we are giving my own beat. One singularism is that my mother is actually from Osun State. Yes, and she's from Ile-Ife. So it's a privilege again. My first time in the palace, and I tell you this is one of the best time in my field of work. We are all very excited, we are all very happy. We must thank you very well. And His Royal Majesty, the King himself. The King is not in support, he will not be here, man. So the King, we bless the King wherever he is. He will live long. Amen. He will grow to see his children. And that blessing will also reach you. Amen. You will be old or not, you will not be tired. Even if you are tired, your children will carry you. Mommy who must go. The prince and the second, I'm the first prince now. So it's really very good. I want to also thank the great Global Fund. JT, if not for them, we will not be here, man. They are representing Global Fund globally. And they are in Nigeria, they are also daughters and sons of the soil. Yes. And JT have one Igbo name. Who can tell me JT's Igbo name? How about Kanini? Olufimilayo. How about Eve? Who want to give Eve crown? Strong word. So these are all, I mean, they are not in Nigeria, they're not from Nigeria, they're not based in Nigeria, but they're like in Nigeria, like Nigerians. And they are Nigerians anyway. The blood that they carry is the Nigerian blood. Because they want to ensure that it's work for Nigerians. I will thank our father to Dr. Charles. You know, I was asking my colleague, I thought RBM was one Igbo man. I said, no. It's the CEO of Yoruba man. I said, wow, son of the soil again. Dr. Charles, we are pleased to have you as the lead for RBM. To come. National Malaria Program, we can't thank you enough. They are the leaders of this whole game. You know, this game we must win, no? And the penalty we will score it, not the other one. And they are scoring goals. There is so much success we have achieved under the leadership of the National Malaria Program. Catholic Relief Services, where I also belong, my chief of party, she's close her eyes, is malaria. In her house, they know how phone again, malaria. She's sleeping, she's dreaming malaria. Every single time, CRS has been committed to ensuring that the support to the Nigerian team is of seamless and successful. Thank you, representing the CRS globally. I want to also thank SFH. SFH, they are like the front runners, the runners. And they've been running very well too. SFH, project director, represented by John, who is the head of SFH as at this point. We thank you for the excellent job. I must thank my brother Chris, who is also a very efficient and committed, quiet and actionable guy. I mean, enough, our colleagues from SFH, all of you will really appreciate all of your support. Our sister from BASF, BAF, who has led the EOLIN process, recovery of old nets, have done very well. So proud of them too for excellent job bringing it to Nigeria, and it's working. Yeah. And when the people are ready to bring their old nets, and again, not just bringing the old nets, they are using the net to recycle for other benefits, food mats, table mat, and cover. IHVM, we're also happy to have you on board. You're already on ground. Integrating TV HIV is not a thing of joke. It's a big task, and there are more coming for you. So, as God has done it for all of us, to do it for the rest of the Nigerian team in the name of Jesus. Any other WHO here present, and above all, God Almighty for keeping us safe. We are traveling from east, west, north, and south within outside the country, and God has been protecting us. We will not say there are no one or two have this house, but we thank God that overall, we can say those we saw 10 years ago are still alive. Those we saw 15 years ago are still alive, and we're waxing stronger. Or should we succeed anyway? Amen. And we shall come back and glorify God to say, yes, we started this in your house, in the palace, and this is how we have achieved, and the privilege will further go down by the time we reconvene here in the name of Jesus. Thank you very much for this opportunity.